I'm Deanna. I'm going to be doing your head, ears, eyes, nose, and throat assessment today. Just going to wash my hands. Okay. I'm just going to take a look at your face, just looking for symmetry, contour, looking at the texture of your hair, making sure that it's not brittle. Color of your skin is normal, not jaundice. Normal for ethnicity. There's no lesions, bruises, any open cuts. I'm just going to palpate your temporal pulse. Good, nice and strong. Okay, I'm going to check your cranial nerves, so if you could just lift your eyebrows up. Good. Can you close your eyes real tight? Good. Can you frown? What about smile with your teeth? And puff out your cheeks. Good. Okay. I'm just going to palpate your masseter and temporal muscles. Clench your teeth together. Open your mouth. Okay, close. Open again. Good. No clicking. Just going to take this cotton ball. You're going to close your eyes, and when I touch your head with the cotton ball, just say yes if you can feel it.
Yes. 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 Yes.
Okay, very good. Okay, can you close your eyes? You're just looking at your eyelids, your eyelashes, eyebrows, no crusting on the eyelashes. Can you open your eyes? Good. Sclera is white, conjunctiva looks normal, no exudate, no drainage. I'm just going to take off your glasses if you don't mind. I'm going to pull down your eyelids here. Conjunctiva is normal. Look up, look down, look left and right. Very good. Okay, so just going to check your accommodation, convergence, and EOM. And so I want you to just follow my finger, keep your head still. Very good. Followed my finger very well. No nystagmus. Now I'm going to dim the lights. And I'm going to check your eyes. I'm going to check for dilation and constriction. Good. Now I'm going to do it again, looking in the opposite eye. Good. Good. Constricts with light. Now I'm going to start 12 inches away, and I'm going to look into your eye. Going closer. Good. I see red light reflex. I see the vessels. Looking medially, I see the disc and the cup. And looking laterally, I see the fovea and the macula. I'm going to check the other eye. I see red light reflex. I see the vessels. They look normal. Looking medially, I see the disc and the cup. And looking laterally, I see the fovea and the macula. Going to check your ears. Ears are warm, no exudate, no lesions. They're symmetrical. Is there any pain when I touch them?
No.
Okay. I'm going to do a whisper test. So I'm going to whisper 3 words into your ear. Just repeat them back to me.
Cat. Dog. Light. Star. Circle. Pen.
Okay. Very good. Now I'm just going to look in your eardrum. I'm going to pull it up and back to look in at your eardrum. Eardrum is pearly gray. No cerumen. Pull up and back. Eardrum is pearly gray. No cerumen. And there was no obstructions, and external auditory canal looked good. Okay, just looking at your nose, I see that it's symmetrical. There's no deviation. I'm going to do a patency test, so you're going to hold one nostril and sniff it. Good. Other one. Good. And now I'm going to look in your nose. Good. Positive turbulence. Mucosa is pink. No polyps. Same with the other side, positive turbulence. Mucosa is pink with no polyps. Now I'm going to check your mouth. If you could just open. Buccal mucosa is pink. Hard palate is intact. Soft palate is intact. Tongue is pink. No signs of yeast infection. Can you say ah? Good. Just gonna take the stick and we're gonna do a gag reflex. Good. Positive for gag reflex. Tonsils look normal. Now I'm going to check your lymph nodes. So I'm just looking at your neck. Everything looks normal. Trachea looks straight. I'm just going to check your pre and post articular lymph nodes. Checking in the front here, in the back, occipital, cervical, submandibular, submantle, subclavicular, no goiters, no mass. I'm going to ask you to shrug your shoulders, so you're going to lift up and we're going to put resistance. Please push them up against my hands. Good. And now I'm going to check your thyroid. So I'm going to give you something to drink. I'm going to feel your Adam's apple. And I'm going to go to the right. Can you put your head down and to the right? Yes. And then you're going to swallow. Good. And now the other way. Swallow. Very good. It moves up and down smoothly. And that concludes our assessment.